thank you for having me here today. I just want to describe, I guess, the development of our education programs from a marketing perspective, something we didn't start doing but ended up turning into that. So we provide a range of education programs at the Motor Neurone Disease Association in New South Wales, and we're based in Sydney. And over the last few years, we've totally revamped our publications and created several new education programs. It's really happened fairly organically. There wasn't some master plan or great grand plan. However, over time, we have used the opportunities as they have arisen to enhance the education and publications we provide. Some of you may have seen our past presentations that we've done on MND Aware, which is an online education program. We've been doing education programs since about the 1990s, I think. But in 2011, we developed and launched our online and face-to-face training called MND Aware. Through this process, we were able to review all our programs and publications for marketing purposes. And we've developed these and created a brand and improved our marketing of these better with better graphics and more colourful promotional material that's been suited to promoting for a website, Facebook. So I'm just going to describe some of those processes and what we undertook to achieve them. So our initial focus was on the development of our resources available for health and community care providers. Why was this? Because the government funded us to do it. They actually gave us some money to develop the online training and the face-to-face training. So just for a bit of perspective, New South Wales is approximately twice the size of the UK and Ireland, with a population slightly more than the whole island of Ireland. So this is our MND Aware online training resource, specifically developed for frontline staff working with MND, and goes into detail of managing care and symptoms, and we encourage people to access it when they do have a client with MND, and it's available free online. We've always had a commitment to educating community and health professionals to give them the skills they need to provide the best quality of care possible. In developing this program, we were led by adult learning principles and wanted to use a variety of learning approaches to assist the learner. This included having all audio transcribed into text, the use of videos and diagrams. We are now able to use these items in a range of education programs and publications with the same look and feel. Also ensures we are providing consistent information, as this education resource forms the basis of all our resources. So we also started to develop a consistent look throughout all our programs, and in particular our logos, which are now quite consistent across our range of programs, and flyers that we use to promote them, either hard copy or online website copies that have a consistent look. We were also able to export from our online training program PowerPoints to be able to give face-to-face presentations. This just required us to review them according to adult education principles, and most of the time we were taking the amount of written material off the page, but otherwise just using the same slides as what's online. So from big things, because it really was a big effort to put together the initial program, the online training and face-to-face, but this continued to grow. Even though our funding ran out, it became this master plan that we had that we could move forward with. So we used it over and over and over again. We developed as part of that training what we called our aspects of care for home and community teams, which was just an A4 publication that went along with the face-to-face training, and it led to the development of the rebranding of a whole series of publications that already existed. So there's the aspects of care for home and community care teams, but there was also an existing publication called Aspects of Care for Staff of Residential Care Facilities, and we reviewed this and we updated the look and feel to be consistent with the new publication. And then there's also a national publication in Australia, which is the Aspects of Care for Primary Care Team, and this has now been developed and has a different look, and now all fits into what we call a series, the Aspect of Care series. We have the publications that have a similar look and feel. And inside they have a very similar look and feel as well. It's a very simple look. It's not full of amazing graphics or colours or whatever. It's very simple so that we've been able to do it all in-house at minimal cost. Then this led to the development of a series of publications using the same approach and adjusting the layout and content to meet the needs of people living with MND and their families. We didn't have any funding for any of this, and while it took time to develop, we had a framework to work from, and the content from our online training and other publications that just needed to be reworked to meet the needs of people with MND. So we had to think about the language, how we approached it so that people living with MND and their carers could actually access these. There are a series of 3 publications at the moment, with one more still to come specifically for carers. So there's the Living with MND, Aspects of Care, which gives an overview of MND and strategies for symptom management. Living with MND Day-to-Day, Strategies for Living at Home with MND, and a more in-depth information and day-to-day tips on living with MND. And then the final one is Services and Resources, which lists the different contact details for organisation, and that's available in a searchable online directory. And then as a result of developing the publications, we went on to develop our one-day education programs and renamed it to Living Well with MND series of workshops. So as a result of this revamp, we also launched this and it's conducted throughout New South Wales, which is quite a big area, so we have to pick 2 or 3 regional areas each year that we can get out to, because most of them require a flight to get there. We had a ready-made logo, we just had to change it to suit the new program, and also a same format for the actual flyer. So the amount of work decreases as we got more and more into this branding that we had consistent look, it wasn't a branding as such. So this led to us rebranding everything. We've still got some left to do, as I discovered, but our information evenings that we conduct every 3 months for people who are recently diagnosed with motor and neurone disease and their family and friends. Our MND education sessions, which are the sort of in-service education when we go around to facilities, health professionals, community care providers to provide face-to-face training. We actually revamped all the PowerPoints. So once again, for consistency, making sure our staff are going out and giving the same information. It doesn't matter who delivers it, it's consistent. And it's also good for training new staff, because we've got the slides, we've got the content written on notes and everything, so really much easier to train new staff. Our Ask the Experts flyer that we have every year, and once again a consistent look for the program. We have a 4-day Care for Carers program that we run for carers. They come in once a week for 4 weeks. But as I discovered, we haven't updated that program yet, so that's how it used to look. So this year will be the year for that. We also have a past carers lunch, so once again they're held a couple of times a year and also in regional areas as required. And then our final new program, we've had a total change in the way services are delivered in Australia for people under 65. So we needed to come up with a new program. This is around consumer-directed care, where people now get their own funding and then they source the services. So we needed to re-educate and start educating private service providers as well as public ones. And once again, it was very easy to pull that program together. I say easy, I didn't pull it together. But, you know, with minimal work, we could pull this together again with the same look and feel. So that consistency continues. It all also looks good on our website as well as on our Facebook. So overall, it's worked really well having that approach. So the benefits, recognised as one of our programs, easy to develop new programs, a template for future design, consistent look to programs and publications, consistent information provided, and Facebook and website ready. So in finishing, I'd just like to thank my whole team at our support services team at MND New South Wales, but in particular Penny Waterson, who's really the brains behind it, has an IT background as well as into information, and Christina and Kate, who are our educators who continue to develop these programs. Thank you. And I do have the publications here if anyone wants to have a look.
Hi, so I get a sense listening to you that a lot of this was about trying to rebrand these things. Could you just describe quickly, maybe a minute, about how people with MND were involved in that discussion, coming up with the logo, the rebranding process, et cetera?
I guess we did primarily do it within our association. We tend to get feedback through our programs. We evaluate all of our programs. So that's, I guess, we've gone ahead and developed it, but because it did start as a professional education program because of the funding source, but we always get feedback as we go along and evaluate.
So having been to visit you in the last couple of months, I've got a much greater understanding of geography.
Yes.
So I'm wondering, with the evening sessions, especially because it sounds really helpful to have something for people newly diagnosed, how you manage the geography around that, and whether you use online streaming, for instance, or some other means of reaching people.
Yeah, I think we don't, basically. People come to us. So our next thing is to try and get those things online in some format, some way. So yeah, that's where we'd like to head in the next year or two.
We've had really good take-up of our regional meetings that are now online streamed, so
Yeah.
I think you could
Great
be
to have a
encouraged that it can work well.
Yeah, great.
Since you already invent the wheel, will you share it with other foundatios?
Asking, since you've already invented the wheel, would you share it with other foundations? That's what the question.
I'm very happy for people to contact me, and I've got my contact details, and I'll be here for the next week, so the next 5 or 6 days, so very happy to speak with people.